My name's Andy Blofield. I'm the Director of IM&T and Chief Information Officer at Plymouth Hospital's NHS Trust. I'm responsible for the delivery of the IM&T service to the organisation, and I'm the Programme Director for the core IM&T programme. We are a large acute hospital based in the southwest of England. We are a trauma centre, major trauma centre, we're a tertiary centre, and we have approximately 6,000 to 8,000 devices. We had a best of breed approach since pretty much 1999. So we would buy clinical systems and we would integrate them together using HL7. That's not largely successful. It was the only game in town pretty much in 99, 2000. There were no big box solutions, but you don't pass an awful lot of clinical information between systems using HL7. So we were looking for a much more integrated model. The core thing we're trying to achieve with this approach, the open standards approach, is to provide the same level of functionality that we could buy if we went to market and bought one of the big box providers, Allscripts, Cerner, Epic, there's lots of them. We want to have exactly the same functionality, but we don't want to be locked into a particular provider. We want the same level of data independence and supplier independence that people are used to with things like PACS. So we've changed our PACS 3 times. We've changed it from one system to another because it's a uniform standard data repository. It's easy. They go away on Friday with one, they come in on Monday and they've got a different one. It's all about the data neutrality, and that's what this open standard architecture will give us. We'll have total data independence. Innovation using the postmodern approach is an interesting challenge, and the way it benefits us, we believe, is that we're not starting from a greenfield position. We've got 190 clinical solutions that are already there, and we want to innovate moving forward, but we know we've got to start with these core 190. So a bimodal approach means we can start with what we already have, and we're moving forward with innovation based on open standard, and we'll gradually eat into those 190, either by working with the suppliers to move their data into the vendor neutral archive, or in the most brutal sense, we'll replace those systems if they can't fit that model. So it really gives us the ability to make progress in a new direction using new technologies, whilst not drawing a line under what we've got already, which we just clearly couldn't do.